For months, these cranes have towered over Southmead on Bristol's biggest construction site, helping to put together the city's new super hospital. But although the skeletal structure is almost in place, it's difficult to visualise just how the hospital will look once it's completed. Which is why I've come to Norway. This is Oslo's Riks Hospitalet. It's widely viewed as one of the best designed hospitals in Europe, which is why the team behind Bristol's super hospital has poached so many of its ideas from here. At first glance, you wouldn't know this was a hospital. Designed like a small city, the central spine of the building looks like a modern-day shopping mall. Natural light floods in. No sign of the dark, prison-like corridors we've become so used to at Southmead and Frenchay.
We think it's very important. I know this varies around the world, but in Scandinavia, and I think in England too, where we are in northern countries, daylight means a lot to us. We have a long dark winter. When summer comes, we want to see daylight. We long for daylight. Also, studies show that being able to see out and seeing daylight, if it's raining, if it's night, if it's day, or if it's sunshine, lowers stress levels.
For patients who are well enough, there are landscaped areas outside the main building to relax in. But those confined to their bed still have a connection with the natural environment. Every patient has a view outside from their room.
I think it's very nice because all the green leaves and it reminds you that life is like that and is supposed to be like that, so you feel fresher and invigorated by it. I do anyway.
So it helps your recovery?
Yes, of course it does. Mental attitude has a lot to do with recovery.
All these ideas are being incorporated into Bristol's new super hospital, but other lessons have also been learned from the Norwegians. We all know how confusing it can be finding your way around a big hospital, but the Scandinavians have minimised the use of signs. Instead, they use artwork to signpost different departments.
Then you can say, it's just past the blue sculpture, and that means a picture, and I think people remember pictures much better when they remember A's and B's and 1s and 2s and 3s and 4s.
I know that's where the child and women department is, that we have been using, and I think I could easily orient myself here.
As at the Riks, Bristol Super Hospital will have bedrooms rather than wards on one side of the building and operating theatres and treatment rooms on the other. It means the structure can be easily adapted to meet changing healthcare needs.
We have more or less all the same activities in the same area. For example, we are now in the 4th floor of the hospital, and all the ORs in this hospital is in this floor. So once you dress in green, you can walk through all the ORs in the hospital. And that means that we are very flexible. If you want to change activities, for example, increase some type of surgery and reduce another, it's very easy to be flexible.
Returning to Bristol, it's clear the new super hospital is not going to be a carbon copy of the Riks, but the Norwegians' design ideas have been inspirational.
We thought it was amazing in terms of what it did for patients, the amount of light that was brought into the building and the views out onto the landscapes and the courtyard gardens. So we wanted to sort of take those really good experiences and hopefully do something even better here for Bristol.
Bristol will soon be able to boast that it has the most modern hospital in the country. An awful lot of thought has gone into its design. Ultimately, it'll be the patients who use it, the people of Bristol, who'll decide whether the planners have got it right. Rebecca Broxton for the West Country Tonight.